Hello, Dr. Hashizume. Thank you for joining us. We
Yeah.
wanted to try to get some of the members of the DIPG DMG collaborative together to talk a little bit about your grant, if that's possible.
Okay, thanks so much.
Well, I'm going to introduce Hide. Hide's from Love for Lucas Foundation. He is a member of the DIPG DMG collaborative, and he has a few words to kind of kick us off.
Okay.
Thank you, Keith. Hi, my name is Hide. So on behalf of the Love for Lucas Foundation and the 27 foundational partners of the DIPG and DMG collaborative, we would like to present you with a grant award for the Anne and Robert H. Lurie Children's Hospital for $100,000 for the study, intranasal delivery of targeting nanotherapeutics for DIPG.
Yeah,
So,
that's good news.
yeah, your grant to test the a new intranasal delivery system looks very promising, and we're fully supportive of your dedication and study of DIPG and DMG. So I'd like to hand over to Pavarti, a fellow DIPG DMG collaborative partner.
Hi, Dr. Hashizume. I'm Parvati. I'm with the Yuvan Tiwari Foundation, which we started in honor of my son who passed away from DMG last July. And we're a proud member of the DIPG DMG collaborative. Our mission, just like all the other members of this collaborative, is to push research forward and to find more favorable outcomes for kids as soon as we can. And we, look through your proposal, your study, and there's so much promise. Not only is it looking at delivering a drug that can make a difference, but also looking at the delivery method and how we can get more of the drug to the tumor and less of the toxicity overall to the children. And so thank you so much for your dedication and your commitment and your passion, and really helping make a difference for all the kids that are battling and all the families that have lost somebody, because ultimately it's all of our purpose to really make a difference and to find something to change the outcome for families and children to come. So thank you so much. We really appreciate what you're doing.
Thank you so much. So this is great news. So and it's so meaningful, not only for myself, but also my lab member and also my research activity against, children with brain tumors, and then to keep a motivation, make a, change. So something we need to change as soon as possible.
Well, we're extremely appreciative of your efforts with this, also, you have the recognition of being one of the novel ideas that came to the DIPG DMG collaborative. This was a rather new strategy that the Medical Advisory Committee was excited about. We'd like to learn a little bit more, but also be able to pass on that information to a wider audience, if that's okay. I don't know.
Yeah, I think I propose, the internet delivery of targeting nanotherapeutics for treatment of DIPG. So, everybody knows, DIPG is devastating brain tumors in children, and it shows, very poor prognosis, within median survival within 12 months. So because of anatomic location within the pons, the surgery is not option for the treatment, and also the deep area of the brain stem prevent most of the chemotherapeutics leads to the tumors. So less than 1% therapeutics go through the blood-brain barrier. So we have developed a new drug delivery system to bypassing the blood-brain barrier using intranasal delivery. So intranasal delivery is a very practical, convenient, and non-invasive method for bypassing the blood-brain barrier to deliver most of the chemotherapeutic agent to the, using a very unique anatomic connection between nose and the brain through the two specific neural pathway. One is the olfactory neural pathway, goes through the upper part of the brain, we call the supratemporal brain, So that brain is caused, occurs for glioblastoma, pediatric high-grade glioma. Most of the high-grade glioma occurs in the supratemporal brain. And the other part of specific neuron is trigeminal neural pathway, which is the lower part of the nodes to go through infratemporal brain, including a brainstem. So for treatment of DIPG, we're using the trigeminal neural pathway. So just give a drug to the nasal cavity to go through the trigeminal neural pathway to the brainstem. Just very quick, within minutes. Most of intranasal drug reach to the brainstem within minutes. So so that's why we try to use intranasal delivery for the very toxic agents. So we have been using intranasal delivery of telomerase inhibitor for the treatment of glioblastoma and also CPT11. They called irinotecan. We're using a liposome encapsulate irinotecan to using intranasal delivery to treat the DIPG. And DIPG tumor growth is delayed, but it's not high effect. That's why we recently using SN38, which is a prodrug of CPT11, more potent activity against the tumors. So we recently published in the journal Neurosurgery. I think it's coming in this month. So, but unlikely with the adult brain tumors, DIPG is a very key molecular characteristic is the histone gene mutations. So A3K27 mutations. So this mutation inhibit EZH2, which is an epigenetic regulator. So target EZH2 functions. And other investigator published, or we published also targeting EZH2 activity for the treatment of DIPG. So we have, in clinical, there is a EZH2 inhibitor FDA approval, tazemetostat. But unfortunately, clinical activity of tazemetostat, when you deliver it systemically, IV injections, does not go through the blood-brain barrier. It's not so much tazemetostat go to get into the brain. So that's why we try to test intranasal delivery of tazemetostat to more delivery to the brain and non-invasively and less toxic.